Okay, hi student. Today, welcome to our Learn Classic Education. Today we are going to read about shock and its nursing management. Now, let's start with meaning of community health and nursing. So, what is community health? Community health basically focuses on the health status of the people living together in a definite area. Okay, so what does it means? That a community is a defined area refers to a group of a people living within a specific geographic location who share common facilities, resources, and social interaction. So examples are like a village community, a school community, a slum community, a tribal community, or a city community. Let me give you a real life example. Suppose people living in a village and share the same water supply, school, health centers, markets, and cultural activities. Therefore, it is called the community in a definite area. So what it do? It emphasize promotion, prevention, and protection of health rather than cure. Okay, so it helps in the prevention of the promotion, prevention, protection of health rather than cure. Community health nursing is a specialized field combining nursing and public health. So care is provided to individual, families, groups, and community. And also the main goal is to improve the quality of life and overall community well-being. So the main function of the community health nursing is to prevent the disease rather than the cure. And how it mainly done? It is mainly done through giving health education, proper well-being, look after the well-being of the family, groups, and the community. Okay. Now coming to the causes of shock. Now there is a major difference between causes and risk factors. Okay, so what does causes means and what does risk factors means? Causes is like they can directly lead to the disease, whereas risk factors are the one they only make a person more vulnerable to the disease. Okay, so because of the causes the disease will occur, whereas because of the risk factors the disease may or may not occur. For example, like the bacteria causing tuberculosis, whereas smoking increases the risk of the lung cancer. Now there may be some smokers that can have the lung cancer, whereas maybe some non-smoker person also can have a lung cancers. So okay, coming to the causes of shock. So what are the causes of shock? First is severe hemorrhage, dehydration, burn, then myocardial infarction, sepsis, anaphylaxis, coming to spinal cord injury, then cardiac failure, and trauma accidents. Trauma and accidents. Now coming to the risk factors. Risk factors are the major surgery, chronic illness, diabetes mellitus, hypertension, and old age. These are the risk factors. Okay. So you need to remember what are the causes of shock and what are the risk factors of shock. Now coming to the types of shock. This is a very important part. Now hypovolemic shock. So what is hypovolemic shock? Hypovolemic shock is the one that is caused by loss of blood or fluids. So like it causing the decreased blood volume and reduces the oxygen supply to organs. So it can result from severe bleeding, burns, vomiting, diarrhea, or dehydration. Let me give you examples. Like a person who loses a lot of blood after a road accident may develop hypovolemic shock because the heart cannot pump enough blood to the body. Whereas what is cardiogenic shock? Cardiogenic shock caused due to the when the heart becomes too weak to pump blood effectively to the body. So it is commonly caused by heart attack, severe heart disease, or heart failure. An example is like a person suffering from a major heart attack may develop cardiogenic shock because the damaged heart cannot circulate blood properly. Okay, coming to septic shock. What is septic shock? It is caused by a severe infections that spreads through the bloodstream. The infections causes extreme inflammation, low blood pressure, and poor blood flow to the organs. Examples is like a patient with severe pneumonia or untreated urinary tract infection may develop septic shock if the infection spreads throughout the body. This is about septic shock. Now the next one is anaphylactic shock. Anaphylactic shock is the one which is a severe allergic reaction that causes sudden widening of the blood vessels. So anaphylactic shock, what it causes? It causes widening of the blood vessels and difficulty in breathing. Now, it may occur after exposure to allergens like food, medicines, or insect stings. So, anaphylactic shock occurs due to the exposure of allergens like the foods, medicines, or insect stings, or any other allergens. Now, let me give you one example of anaphylactic shock. It's like a person allergic to peanuts, okay, or maybe a person allergic to prawn, fish, or anything may suddenly develop swelling, breathing difficulties, low blood pressure after eating peanuts, also like dyspnea and everything. Then coming to the last one, that is neurogenic shock. So caused by spinal cord injury or nervous system damage. That is, neurogenic shocks occurs due to the damage to the brain or spinal cord. What it causes? It causes loss of nerve control over blood vessels. So this leads to sudden drop in the blood pressure or poor circulation. Example is like a person with a severe spinal cord injury after a fall or accident may develop neurogenic shock, right? So because the nervous system cannot control blood vessels tone properly. So let's revise. Hypovolemic shock is caused by the loss of the blood or fluids. Cardiogenic shock caused by the failure of the heart pumping. Then coming to the septic shock, which is caused by the severe systemic infection. Anaphylactic shock, that is caused by the severe allergic reaction. And neurogenic shock caused by the spinal cord injury or nervous system damage. Okay, then coming to the signs, symptoms, causes and management of each types of shock. So starting with hypovolemic shock. Okay, so what are the causes of hypovolemic shock? Causes are hemorrhage, vomiting, diarrhea, burn, and then excessive sweating. All these are the causes of hypovolemic shock, like heavy bleeding after a road accident. Then signs and symptoms, what you will see in a hypovolemic shock? You will see hypotension, tachycardia, cold, clammy skin, weak pulse, decreased urine output, and then thirst and restlessness. Then management, the main management, what we have to do is we have to stop the bleeding immediately, give IV fluids or blood transfusion, provide oxygen, and monitor the vital signs. So this is the main management. So what we have to do here is we have to give IV fluid replacement, blood transfusion, oxygen therapy, and monitor the vital signs. Okay, so these are the causes, signs, symptoms, management of the hypovolemic shock. Then coming to the cardiogenic shock. In the cardiogenic shock, what is the main causes of the cardiogenic shock? That is myocardial infarction, heart failure, arrhythmias, then cardiomyopathy. So what does cardiomyopathy means? So cardiomyopathy is a disease of the heart muscles in which the heart becomes weak, enlarged, thickened, or stiff, so making it difficult for the heart to pump blood properly to the body. So that is the cardiomyopathy. Now coming to the signs and symptoms. What are the signs and symptoms? That is severe chest pain, cyanosis, pulmonary edema, hypotension, tachycardia, and breathlessness. So these are the signs and symptoms of the cardiogenic shock. So in the cardiogenic shock, the main management what you have to do is to give oxygen, medication to improve heart function, monitor ECG, and provide emergency cardiac care. Okay, coming to septic shock. The septic shock main causes are severe bacterial infection, septicemia, pneumonia, urinary tract infection. So these are the main causes of septic shock. Then signs and symptoms. Signs and symptoms are high fever, high fever, warm flushed skin initially, tachycardia, hypotension, altered mental status, rapid breathing. Warm flushed skin initially. There will be initial warm flushed skin. Now management, what the management you have to do is administer antibiotics, IV fluids, oxygen therapy and monitor blood pressure closely. So you have to give broad spectrum antibiotic because it is a case of infection. Then IV fluids, vasopressors you have to give, oxygen therapy and infection control measures. Okay. So these are the main management of septic shock. You need to remember the management, signs and symptoms and causes. Now what is vasopressors? Vasopressors are the medicines that constrict, that causes the narrowing of the blood vessels and increase blood pressure. So they are mainly used in emergency condition like shock when blood pressures becomes dangerously low. Now common vasopressors are like the dopamine, norepinephrine, epinephrine, vasopressins. These are the common examples of the vasopressors. Now coming to the anaphylactic and neurogenic shock. Now anaphylactic shock, the main causes of the anaphylactic shock is drug allergy, insect sting, food allergy as we have discussed. Then symptoms are like the dyspnea, facial swelling, hypotension, wheezing. So these are the symptoms of the anaphylactic shock. Then treatment are like adrenaline, antihistamines, corticosteroids and oxygen therapy. So these are the treatment of the anaphylactic shocks. Okay, you need to remember one each examples of the adrenaline injections, antihistamines injections, corticosteroids and corticosteroids. Okay, now coming to the neurogenic shock, that is spinal cord injury, head injury. Symptoms are like the hypotension, bradycardia, warm dry skin. So these are the symptoms for the neurogenic shock. Now then coming to the treatment is IV fluid, vasopressors as discussed and then spinal stabilizations. Okay. So the main thing what you have to do in the management for the anaphylactic and neurogenic shock is give epinephrine injection immediately, provide oxygen, antihistamines, IV fluid and emergency care. Whereas in the neurogenic shock, stabilize the spine is our first thing, provide IV fluids, oxygen therapy, medications to maintain blood pressures and close monitoring. Okay. Then coming to the general clinical features of shock. So first is early signs. So we have to detect the early signs of the shock so that we can provide immediate care and prevent the complications. Now anxiety. Suppose a patient with severe bleeding after an accident becomes frightened, worried and repeatedly asks, am I going to be okay? So this is the first sign of shock. So because the brain is not receiving enough oxygen, it can cause shock. Then next is restlessness. Restlessness is like a patient with septic shock keeps changing positions in bed. So appears uncomfortable and cannot remain calm due to reduced oxygen supply to tissues. Okay, so you have to detect this. Then tachycardia, you all know that is the a patient's with dehydration has a pulse rate of 120 beats per minute as the heart tries to pump more blood to maintain circulation. Then comes the pale skin. Like a trauma patients with blood loss develops cold, pale and clammy skin because blood is redirected to vital organs. Now these are the early signs. You have to detect all these early signs. Then coming to the late signs. Late signs is severe hypotension. Now patients with cardiogenic shocks develops a blood pressures of 70 to 40 mmHg due to failure of the heart to pump effectively. Okay. So this is severe hypotension. Then coming to confusion. Example like an elderly patient with septic shocks becomes disoriented and cannot recognize family members. So because of reduced brain perfusion. So these are the late signs. Then cyanosis, you all know what is cyanosis. So a patient in severe respiratory shock develops bluish lips or fingernails because of the blood is not carrying enough oxygen. Then oliguria. Oliguria also you know. A patient with hypovolemic shock passes only 100 ml of urine in 24 hours. Because why? Because the kidneys are receiving inadequate blood flow. So there is a decrease in the urine passage. that is oliguria. Now coming to loss of consciousness. So suppose a patient with untreated anaphylactic shock suddenly becomes unconscious due to severe reduction in the oxygen delivered to the brain. So these are the late signs. Now diagnostic tests, so there are some diagnostic tests through which we can detect the shock, that is blood pressure monitoring. A nurse checks the blood pressures like every 15 minutes in a patient with dengue shock syndrome to monitor the worsening hypotension. Then coming to the ECG. So ECG is performed in a patient with chest pain and shock to detect what myocardial infarction causing cardiogenic shock. Then comes the ABG analysis. How it is done? There is a process where the ABG analysis is done, and it is done in a patient with septic shock, shows metabolic acidosis and low oxygen level. Then comes the blood test. Blood test in septic shock reveals elevated white blood cells, that is WBC count, and high serum lactate levels, indicating infection and poor perfusion. Okay, so these are the early sign, late sign, and diagnostic test. Now coming to the nursing management. So these are the some key nursing management which is very important, that is you need to remember it. Maintain airway patency, administer oxygen, establish IV access, then monitor the vital signs regularly, maintain fluid balance chart, access urine output, then provide psychological support, administer prescribed medications, prevent complications, and report deteriorations immediately. Means any deteriorations of the health, we can report it immediately if we know the early signs and the late sign. Okay, so early recognitions and the promote treatment are essential to save the patient's life. Okay, thank you student.